All right, welcome everybody. Thanks for joining us on tonight's info session. My name is Brittany Patterson. I'm one of the college navigators here at Central Virginia Community College. These information sessions are recorded every Tuesday evening, 6 to 6:30 p.m. If you have missed some past ones, that's okay. They are recorded and uploaded to our YouTube page. So check out the CVCC YouTube page or just go to our website. You can get to the recordings from our home webpage. Um, Tonight, we've got our EMS program head, Mr. Joey Greer, joining us. So he'll be going over his program. Feel free to post any questions in the chat or raise your hand during, but we will have question and answer at the end of his discussion. And then, yeah, we'll go ahead and get started. So, Joey, I'll pass it on to you.
Well, thanks, Brittany. Thanks for that introduction. And I want to welcome all y'all to tonight's little talk that we have about our program. And hopefully this can reach lots of y'all that want to join into the EMS program that we have here at CVCC. But first, we'll kind of talk about the program. There's 3 levels of EMS that we have and that we offer here at Central Virginia Community College. The first level is your EMT or Emergency Medical Technician. And I'll break down the 3 levels singular after I introduce the 3 of them. And then we have advanced EMT, which is AEMT. And then we have our paramedic, which is our 2-year degree program. All right. And so breaking down the 3 sections is EMT. And the EMT, we start covering anatomy and physiology. We start covering pathophysiology, pharmacology, how to manage a person's airway. So if someone's having trouble breathing, if someone's have choking, any sort of airway issue, you'll learn how to manage it in that EMT level. How to take vital signs. This is a big step for our EMTs. And one of their first early classes is learning how to take vital signs. And generally, if they haven't had exposure, it takes them a little while to get it, but by the end of class, they are zipping right through vital signs and moving on to the next section. We'll go over medical and trauma assessments and how that relates to the body systems and different disease processes in the medical section and how that relates. And then different traumas, different way people are injured and how they're injured and the kinetics and energy that is associated with that injury, whether it's a motor vehicle accident or just a simple fall. We'll kind of go over it all. And then like operations, like we'll talk about those incidents where like a truck might spill a hazardous material on the road. What do you do about that? How do you know what the hazardous material is? Or operations such as like a confined space, like a building has collapsed, and like how to react in those situations as EMS. Now, we don't teach you how to go into the building and search for the people, but how to treat people and that have experienced those, or even going into like our if there's a bombing or some type of terrorist attack. Sorry, I couldn't think of what I was trying to say. Like a terrorist attack. Hopefully, we don't experience that, but if you may be in an area that does, because not only can you become Virginia certified in this class, but you can also become nationally registered, which means you will be recognized by a national institution for EMTs. And you may be able to go to different states and practice there after the state grants you permission. And then we go over pediatrics and geriatrics. So pediatrics is our little babies, all the way up to 1 year old. And our geriatrics are our elderly folks who are over 65. And we are seeing an increase in geriatrics just from the aging population that we have. So that's a very important section that we go over. And then we'll even teach you how to deliver a baby if that is something you're interested in. That is one unique challenge, is delivering baby, and it's amazing that they teach that at the EMT level. But all our students really enjoy that and really that really comes to life. And we have simulators that simulates that. And so you can imagine that night how excited and charismatic and everything that the students become trying to deliver babies. But so some of the rules to coming into the program, you must be at least 16 years old. So this is open to our high school students that are at least 16. So generally our 11th and 12th graders that are in high school, they can take this class, and it's part of our CTE Academy. So if your school participates in our CTE Academy, this may be a ideal way to get your EMT and maybe little or reduced costs. So it depends on your school district. You also have to get CPR certified, but don't worry if you're not CPR certified. We cover that class as well too, and that's a 1 day class that you will have to get CPR certified through the American Heart Association as a basic life support healthcare provider. But if you are CPR certified, we also accept those certifications, and we can maybe give you some credit for prior learning in that situation, as long as it meets the criteria of the class and the aspect of the class that we need, is such as most of them say healthcare provider somewhere on there if it's one that we accept. But as I said earlier, it leads to both national and a state certification. You do have to pass a criminal background check, which is free, and that is through the state. You do a 10-hour clinical rotation. 5 hours are at the hospital, and 5 hours are on an ambulance somewhere in the area. So it could be Lynchburg, Amherst County, Bedford County, Campbell County, Appomattox, any of those locations. You do have to maintain an average of 77 in our class, which is a little bit higher standards than normal. But you're going to be having someone's life in your hands. So we want to make sure that you are prepared when you leave our class. And then there are some testing fees, but the good thing is your testing fees are covered by the state of Virginia for your first attempt. As long as you pass the National Registry on your first attempt, your testing fees will be covered. And that's about savings of $110 is what it costs for one attempt. Now, if you have to go 2 or 3 attempts, hopefully you don't have to do that. You'll have to cover those, but the state will cover you on your first attempt as of right now. Our current pass rates right now for EMT is about 85% of our students pass EMT at the national registry level, at the national test. So they're becoming certified and hopefully starting practice inside of the state of Virginia. And the test, if you want to know more about that, it's an adaptive test. So the adaptive test means that you have to, as you answer a question, they get harder and harder and harder as you answer them correctly. And then if you miss a question, then it will kind of go back down a level, and it looks to see that you stay on trend and you stay above that 70 percentile trend. And so with that, the test can be anywhere between 70 questions and 150 questions. So we don't know exactly where it'll end at. Some people it ends early, some people goes all the way to 150, and then some are in between there somewhere. And then everything transitions over to the state. Once you pass that, everything transitions over to the state of Virginia, and you become certified as an EMT. So is there any questions on EMT? And
Yeah, so one question in the chat. So current volunteer firefighter wanting to know if that would kind of help with any aspects, going through the EMT program.
yeah, so being a current volunteer firefighter will help in many aspects. So generally, most agencies require their firefighters to become CPR certified. So that certificate, obviously, like I said earlier, you may get credit for prior learning for that if you can provide a certification. Now, some agencies do it inside of their organization, but if it's not backed by a national organization, we can't accept it. But you still have that knowledge. So you come into class with that knowledge, so you're a step ahead of other people already. And other ways that it helps, like when we was talking about those operation classes, a lot of that is covered in your firefighter training So those hazardous incidents that we were talking about, or those building collapse, or that terrorism response that we talked about, they go over it in your fire training as well. So in that section of the class, you'll have a step up there too. And then plus you kind of doing the fire and EMS, you kind of get to see how everything already works. So you kind of have a good understanding of just the operations of day-to-day operations, not necessarily special operations like those hazardous materials and things. So being a volunteer firefighter will definitely help you in this situation. So any other questions before we move on to AMT?
Nope, none.
All right. So then our next level is advanced EMT. And with advanced EMT, you have to be 18. So this one you can't do in high school, and you have to have a high school diploma. And you have to have it by the first day of class. So it can't be one of these things where, well, I graduate in 2 weeks. No, sorry, we have to have it on that first day of class to allow you to stay in the advanced EMT class. And the advanced EMT, it goes over a lot more stuff. You get to learn how to start IVs. So you can give drugs through that IV port. So you'll stick a catheter inside someone's vein. But also you learn how to do IOs, which are intraosseous access. And they actually go into the bone of a person. So it drills into a bone just like your Milwaukee drill set that you may have seen. Doesn't quite look like that, and it's more medical grade, but it'll go into the bone, and that acts just like an IV as a replacement of an IV. So we can give all the same medications through that we can give through an IV. You also learn how to calculate medications and how to administer different medications and more medications that you learn from your EMT level. You go into deeper pathophysiology of diseases. And you learn more of those medical and trauma diseases and how it works on the cellular level, how the body responds to these different diseases and processes that happen. And then once again, we go back and review our EMT concepts, because our EMT is like our foundation. If we don't have a good foundation, then anything that we build on will not be steady. So we go back and really review those EMT concepts to help. This is also a national registry certificate and a state certificate. So if you take this, you will get and pass, you will get certified at both levels. And it is also a national test, and this test is a little bit different. This test is a linear test, which means it's a set number of questions, and you must maintain above a 70 to pass that. So it's not that adaptive test where we don't know where it's going to end at. It has a set number at 150 questions, and you have to pass that. And come July, they're actually changing it a little bit. They're making it more scenario based versus knowledge and cognitive based. So you have a little other element there with that. So y'all will, if you're in the AMT program, you'll be taking the new cognitive exam come after July 1. Clinicals, a lot more clinicals than your EMT. So you only have 10 hours of clinical time in your EMT, but you do at least 36 hours in emergency department and then 24 hours on the back of a medic unit. But the time is not really a big issue with AMT, because generally students need more time to get particular skills that they're looking for. So they have to administer so many medications. They have to start so many IVs. They have to see so many patients that are having breathing issues, so many patients that are having chest pain issues, so many geriatric patients, so many pediatric patients. So they have those skill sets that they have to prove proficient inside their clinicals. And of course, we have a whole list of that we give you before you start clinical, so you know it's not a surprise of what you need. But the minimum, like I said, is 36 hours in the hospital and 24 on the back of the ambulance. And generally, every student goes more than those minimum hours. But clinicals are, so let's talk more about clinicals. Clinicals are self-paced. obviously you have a start time and a due date, but they're self-paced. You get to schedule them at your own convenience, as long as they're not during class time. And there's availability of scheduling, and we use a scheduling system that you would log into to see that. You can schedule them when you're off work, um, when so there's not childcare issues, there's not any of those other issues that might run into, because we have availability pretty much 24 hours a day. You can go to the emergency room as a student. Now, some students don't like that 11 p.m. to 11 a.m. shift, and then some students love it. But or 11 p.m. to 7 a.m. is another shift. So if you're a nighttime person, you're already working a nighttime job and your body's already set to that, then you can take nighttime clinicals on your days off. So you're not having to turn around and wake up at 7 a.m. or not wake up 7 a.m., be at a clinical at 7 a.m. So waking up even earlier than that. So it really gets set around your schedule and to really help the student get around their daily life. So whether it's family issues, whether it's work issues, they can really work around it. Just like our EMT class, you have to keep a 77 average in our class, in our AMT class. You have to pass a final exam. We call it a capstone exam in order to take your test. That's what we do as a program. You also have to have your fingerprints completed with this, a background check. And then there are some disqualifying things that will keep you from becoming EMT or AMT if the background check comes up. Generally, I tell students if they feel like that might be an issue, just to reach out to me and we can discuss it because there's a few different ones. But even if it's a felony, depending on what the felony is and how long it's been, we can look at that. So reach out to me and we can discuss that further if that's a fear that you may have. So there's the written exam for this one is not paid for by the state, so you'll have to pay for this one, and it costs about $150, and you get 3 attempts to pass it. Hopefully, you pass on that first attempt, and it lasts anywhere between 3.5 to 4 hours is how long they're predicting it's going to last with this new test. They haven't had any classes take it yet because it's not open until July, but that's what their prediction is, and I'm sure they've done some alpha and beta testing on it, so I'm sure they have some idea. Our current first pass rate in the AMT level is at 80%. So most of our students pass first pass rate, and our cumulative 3 attempt pass rates is at 90%. So you have a good chance in the first 3 times to pass. And that's kind of AMT in a little nutshell. So let's.
We've got one question. Good question. Can you elaborate a little bit on even going back to like EMTB? So the basic being the first step, right? And then they can go into AEMT advanced, and then you'll cover with paramedic. The way that the classes are set up. So the options as far as like days or even like the length sometimes. I know the basics are kind of easy, and then I think it gets a little wild sometimes when you go on with all the different options. But could you talk a little bit to that?
Yeah, so our EMT times are set up on Mondays and Wednesdays, and there's a daytime option and a nighttime option. So the daytime options from 8 a.m. to 12 p.m. It's a 4-hour class on Monday and Wednesday, and then the nighttime option is from 6 p.m. to 10 p.m. So kind of allowing those students that work during the day to come at night and get their EMT. Our AMT is offered right now only during the daytime, but it's offered on a split shift. So you come either Monday and Wednesdays, or Tuesdays and Thursdays. But you can alternate those days if you need to work around your schedule. So especially for the ones that work 24 hours, they need that ability to alternate. So if they have to come to one Monday or one Tuesday, and then one Wednesday or one Thursday. It doesn't matter how they do that as long as they come to one of each, and it's covered. So this week it may be a Monday, Thursday. Next week it's Monday, Wednesday, and then the following week it may be a Tuesday, Thursday. It all depends on the schedule, and so we try to help that 24-hour schedule out. And with that, rotating classes, it allows anyone, no matter what their 24-hour schedule is, because there's several different 24-hour schedules. The city does a 24/48. Some of the counties do a 24/72, so that's a little bit better. They get 3 days off. And then some of the counties do what's been known as a Kelly schedule, and that's a work a day, off a day, work a day, off a day, and then off 4 days. But the rotation of Monday, Wednesday, Tuesday, Thursday allows students to come during those 24-hour schedules. So that was a good question. And we allow the EMT class to flip back and forth between night and day. So if you're on a rotating schedule, maybe you work a week of nights and then a week of days. If you have to rotate, as long as you communicate that with the instructors, we allow you to rotate between that too. So hopefully you can get your EMT as well. So good question. Thanks, Brittany. So paramedic talking points. So not only with the advanced EMT are you starting IVs and IOs, but now we're getting into very advanced pharmacology. So you can start recognizing EKGs, you can do more drugs, you can take care of really every single patient that's having an emergency issue until you get to the hospital. So you are at the top level of pre-hospital care at this point. You have an advanced understanding of pathophysiology. That's normally the most hated class in our curriculum right now is pathophysiology. But by the end of it, students like, okay, I've learned so much. It was just hard during it. So you still have to be 18 years old, just like you do with your AMT. You also must pass a background check, and just like with the previous levels, if you think there's something that may come up, then just reach out to me and we can talk about it beforehand. If you're unsure, you have 144 hours of clinical time in the emergency room, and then you have 160 hours of field rotation, and that's just in your first year. So a lot more time than your AMT. We do hybrid learning and with our courses as well. So we do some asynchronous learning online on our campus learning management system. So there are things that you will have to do outside of class time on campus and submit those. And then we also have that face-to-face time too, so students don't get lost. And then of course all of our labs and clinicals you can't do virtual. You need to be there actually assessing patients and looking at patients and touching patients. And our labs are the same. You got to be there doing that too. You'll get state and national registry certified in this as well. This is another adaptive test, so anywhere between 75 and 150 questions. This test fee is 175 right now. It's set to go up. And you have to go to a testing center to take this. And you have to go to testing center the other two as well. I forgot to mention that. And the closest, it's a Pearson View Testing Center, and the closest one. We have one in Lynchburg, and then there's one in Roanoke and Charlottesville as well. So students have the option to go to different places. During your hospital clinicals, which is a little bit different because EMT and AMT, you did all emergency room, which you do a lot of emergency room at paramedic, but you also get to go to the intensive care units. So the medical intensive care units, the neurological intensive care unit. You may also get to go to the neonate intensive care unit. So our paramedics love that that clinical rotation. If you haven't seen a neonate, I mean, they're about the size of a hiccup, and they are just awesome to see. The paramedics learn so much from those nurses. Those nurses do great work, and it is just one of their most favorite clinical that they have. They also get to go to the cath lab. So the cath lab is the cardiac cath lab is where the doctor will go in through generally one of your arteries, either through your leg or through your arm, and then they take a wire and go all the way up to your coronary arteries to open up blockages that you may be having from a heart attack. Um, and although our paramedics don't get to do much in that clinical, they get to see a lot, and they really enjoy that clinical as well. And then the other two clinicals that in your final year that the students like is your uh, obstetric clinical, so delivering babies. They can see anywhere from C-sections, or they can have a regular birth that they assist with, and students really enjoy that one. And the other one is going to the OR. And in the OR, you're not really there in the operating room. You're not really there to see the surgery because we don't perform surgery. You're more there to understand the airway and how to control the airway as a paramedic. So you can do something called intubation as a paramedic, where you'll stick a tube in a patient's trachea to help them breathe if that situation arises. So you learn the anatomy of the airway there, and you learn some techniques how to use that intubation equipment, and then or some type of other advanced airway. And then the last semester, our students for clinicals have to ride 96 hours on a medic unit, and they have to get 20 EMS calls where they're the leader of the call. So them being the leader of the call means they handle the call from step 1 to step 99, however many steps it is for that call to be handled. And now, of course, they have a preceptor, and they're there to catch them if they fall, but hopefully they don't fall, and they have to get 20 of those calls in a row where they're the leader. So they could be at call 19 and have to start all the way back over at 1 if they mess up. But luckily, that doesn't happen that often, so don't let that scare you. They but they get 20 consecutive calls, and then they're done, and they can then test for their paramedic at the National Registry level, and then they will automatically become Virginia certified. So that's our 3 levels and kind of how they go. The clinicals for the paramedics is like the AMT as well. It's on your time, and it's through a scheduling system. Now, with some of the specialty sites, we don't have as much time like we do in the emergency room. So that's kind of, those may be more difficult to get into, but you have to have them. But the emergency room and ambulance time, we normally have pretty much time anytime that you're available. We have time available. So, and then you got, like I said, this is an associate's degree, so you can also complete your general education hours. And Brittany, do you mind sharing your screen so we can look at those general education hours?
Yeah. So just showing the paramedic program.
Yeah, just show the paramedic program, and then we can.
All right, you guys should be seeing my screen in a moment. Do you see the homepage by chance?
Yep, looks good.
All right, programs and public. All right, paramedic. All right, hold on. Let me scroll on down here. Okay, can you see that okay? The classes listed?
Yep.
Right.
So
EMT, right.
Yep, our online has a kind of a pathway for you already to follow. If you kind of want to check it out and see what classes to take. And as Brittany highlighted earlier, you have your EMT as your your CPR, EMT as your first 2 steps there. And then you can complete out your EMT Plus certificate with STV 100, CST 126, which is impersonal communication, or you could choose another humanity if you don't like that, or you could do And then you got to do Psych 205, which is personal conflict and crisis management, which in EMS we run into a lot, personal conflict and crisis management. So um, you have an option with your Bio 145, which is basic human anatomy and physiology. You can do that course, or you can do the Bio 141 and 142, but you have to do both sections of it. And if you do both sections of the bio, it will count as one of your general education electives. And then English comp, you'll do that in your first or second semester in the program. And
That's it, right?
and that's it, except
Yeah.
for unless if you did bio 145, you'll have a general education to
Right.
do somewhere. Our general education elective. And so that's it. And then you will have your associate's degree. And if there's paramedics out there that don't have their associate's degree, they can still come to CBC and we can give you prior credit, prior learning for most of your EMS classes, and then you can take your general education requirements and get your degree that way as well. So if there's any paramedics out there that's still looking for that. And we also offer our nurses can come in and they can get some prior learning. If they have their EMT, they have to be EMT certified first. But if they have their EMT and they have their RN, we can give them some prior learning for that registered nurse. So, but that's all I have, unless y'all have any questions.
I got a couple questions in the chat. So kind of following along lines of prior learning, when he was talking about getting credit for prior learning. If you have done any AP, any AP classes, they were asking about credits being accepted, like for classes like biology, or even certain electives. If you did like a government AP or psych AP, yes, we do accept AP credit. So here at CVCC, scores 3 or higher will plug in. So if you took an AP class and you took the exam, and you got a score of a 3 or higher, definitely get that to your advisor so you can get credit awarded. All right, so another question, is the American Heart Association one of the recognized CPR certifications?
Yes, it is.
Yes.
And that's the one that we use here at Central Virginia Community College.
Perfect. And then last question. So after passing the NREMT, okay, yep, to get a job at the fire department, or is it possible? So sorry. All right. Would it be possible after passing the NREMT to get a job at the fire department? And if so, like, would you recommend it?
So yeah, it's 100% possible. Every agency, as far as like what they require after you get employed, is a little bit different. I know Lynchburg right now, they make their EMT. You could be a paramedic, and they make you go back through EMT course again
Mm,
when you're in the academy, in their academy, and that's what they have right now set up. That could change down the road, but absolutely, I recommend any of our agencies around here for a good employment opportunity. Whether, like I said, it's Lynchburg, FMAX, Amherst, Campbell, or Bedford, all of them are great agencies to work for, and they really will help you with anything that you need. Most of the county agencies, you have to have your EMT prior to applying. So FMAX, Amherst, Bedford, and Campbell, you would have to have that EMT prior to applying. Lynchburg is the only one right now. Like I said, this can change. Lynchburg is the only one that will hire you without EMT or fire training.
good information. All right. So that looks like all the questions we've got for now. So thank you so much, Joey, for all that information. This has been awesome. Just a reminder that the next session will be March 19th, and it's going to be focusing on our early childhood program. But like I said, if you want to go back and view any other programs, you can get to them from our website or the YouTube site. And this was a lot of great info. So feel free to go back through this and just listen to Joey kind of talk through it all too if you feel like you missed anything. But thank you for the great questions and thanks for joining us tonight. And that's it. We'll go ahead and wrap it up with that. All right. Well, you guys have a great rest of your night. Okay. Thanks. Bye.
All right, thank you, Brittany.